Hello and welcome to South Sound Radiology. I'm Dr. Timms, one of the radiologists in this practice. Your healthcare provider has referred you for an epidural steroid injection, and I will briefly describe the rationale behind the procedure and the potential benefits, risks, and alternatives to the procedure. Low back pain and sciatic pain can result from a variety of causes, but it is often the result of nerve compression and inflammation, usually from disc herniation. This irritates and sensitizes the nerves, resulting in the pain you feel. Steroids are a class of medications known to reduce both swelling and inflammation. Delivering steroids directly into the epidural space near the affected area should help reduce the nerve irritation and sensitivity, with the desired result of reducing the pain. Up to 75% of patients can get some degree of pain relief from the procedure, ranging from mild relief to potentially complete relief. The duration of pain relief also varies, ranging from days to potentially a year or more. The hope is that the relief will be sufficient to allow you to return to a more normal lifestyle or allow you to progress with a rehabilitation program. You should be aware that it is not possible to predict, based on physical exam or imaging studies, which patient will benefit the most from this procedure. But we do know that it is more effective in the acute setting and best with symptoms related to a disc herniation. You should also understand that this is a so-called palliative procedure and it is not a cure for anatomic abnormalities. The procedure is very safe with very low risks, including but not limited to bleeding, infection, and nerve damage. Another risk is inadvertent dural puncture, also known as a spinal tap. While this is not harmful in and of itself, this could require that the procedure be rescheduled. In addition, dural puncture could result in a headache, which usually gets better in a few days, simply with bed rest. Rarely, a blood patch procedure may be necessary to alleviate the headache. In addition to the risks of the procedure, a small percentage of patients will experience side effects from the injected steroid medication for a few days. The most common being transient flushing with a feeling of warmth, so-called hot flashes, and restlessness or irritability with difficulty sleeping. Diabetics may notice an increase in their blood sugar levels. Certain patients are at increased risk for the procedure and should not have the procedure performed, including those with local or systemic bacterial infections, pregnancy, bleeding problems, uncontrolled medical problems, patients whose back pain is from a tumor or infection, or patients taking blood thinner medications such as Coumadin, Lovenox, or Plavix. If you fall into any of these categories, please inform the technologist or radiologist prior to the procedure. Certain allergies could also interfere with the procedure, including allergies to X-ray dye, lidocaine, latex, topical betadine solution, or tape. If you have such an allergy, please inform the technologist or radiologist prior to the procedure. Alternatives to the procedure include physical therapy, surgery, or medical therapy such as oral steroids, non-steroidal anti-inflammatory drugs such as ibuprofen, and narcotics. The procedure will be performed by a radiologist with the assistance of an X-ray technologist. You will be asked to lay prone on the fluoroscopy table, and a suitable site on your back will be localized. The site will be cleansed with an antiseptic solution and anesthetized with lidocaine, which will transiently pinch and burn similar to a bee sting. A thin needle will then be carefully and slowly guided into the epidural space. Once the optimal position has been confirmed by a small injection of X-ray contrast, the steroid solution will be slowly injected. Most patients find the procedure easy to go through, with only minor pain, pressure, or discomfort during the needle placement and injection of the steroid. After the procedure, you may experience mild tenderness at the injection site for a couple of days. We recommend that you avoid strenuous activities for at least 24 hours. You should understand that steroids take time to work, and it may take a day or two for your symptoms to improve. You may actually experience slight worsening of your symptoms for a day or so as a response to the procedure. When you do start feeling better, remember to take care of your back and be careful not to overdo it. Also, please let your healthcare provider know how the injection has worked for you. Please feel free to contact our office if you think you may have a problem related to the procedure. Thank you for your attention. If you have any questions, please ask the technologist or radiologist involved with your procedure.
Our goal is to make you as comfortable as possible. If you have any questions or if there's anything we can do, please let us know.